There are certain eye conditions, are more common in people with attention deficit hyperactivity disorder. These include refractive errors, such as astigmatism, and convergence insufficiency, which makes it difficult for the eyes to remain aligned when looking at nearby objects. However, visual impairments are not symptoms of ADHD. While there appears to be an association between some eye conditions and the disorder, scientists are not sure what the connection is. ADHD is a neurodevelopmental condition that affects attention and impulse control. It causes symptoms such as hyperactive behavior, such as being unable to sit still, impulsive behavior, such as taking unnecessary risks, difficulty concentrating, especially for prolonged periods, difficulty with organization, such as remembering to do homework or chores. ADHD can be predominantly inattentive, which means that it mainly affects a person's ability to focus. It can also be predominantly hyperactive impulsive, causing more of this behavior than any other symptoms. People with combined ADHD have a mixture of both. Certain health conditions are more common in people with ADHD. Some examples of these include behavioral disorders, learning disabilities such as dyslexia, and anxiety or depression. A lesser-known coexisting condition is visual impairment. Visual disturbances are not part of the diagnostic criteria for ADHD. However, there is an association between conditions affecting eye health and ADHD. Convergence insufficiency means that the eyes lose alignment when a person tries to focus on a nearby object, causing blurry or double vision. A 2012 study found that children with ADHD had more convergence insufficiency symptoms than those without ADHD, and that convergence insufficiency was more likely to affect their performance when they had ADHD. Color perception. A small 2014 study found that young adults with ADHD were more likely to have difficulty perceiving colors in the blue range. However, as the study only included 60 people, the findings may not be generalizable. Conditions and ADHD appear to be related, but there are some theories. The first relates to executive function. Executive function refers to a person's ability to plan, organize, and pay attention. People with ADHD sometimes have lower levels of executive function than people without the disorder. However, the authors of the 2016 analysis suggest that those with visual impairments may experience this because they have to devote more of their attention to navigating the world, and so have a reduced ability to focus on other things. This may exacerbate ADHD symptoms or make them more obvious. Another potential factor is misdiagnosis. Mild to moderate visual conditions are not always obvious in children, and young children may not be able to describe their visual impairments to adults. Difficulty seeing may result in children losing focus or taking a long time to complete tasks, which people may mistake for ADHD symptoms. There is no evidence that eye health conditions play a role in causing ADHD. No, not being able to unfocus the eyes on command is not an ADHD symptom. However, some eye conditions that affect the eye's ability to focus are more common in people with ADHD. For example, convergence insufficiency makes it difficult for the eyes to focus on close objects. This does not mean that convergence insufficiency is an ADHD symptom, only that there may be an association between the two conditions. People with ADHD and eye conditions that affect vision may find that receiving treatment for their visual impairment helps with their ADHD symptoms. A 2012 randomized controlled trial on convergence insufficiency in children with ADHD found that after treatment for their eyes, the children reported fewer eye-related symptoms and had better performance when reading. Once a person has clearer vision, they may find it easier to read, remain focused, and complete tasks. Some of the treatment options that could help include glasses or visual aids. It can help to ensure that adults and children with visual conditions have the correct glasses or contacts for their needs. Vision therapy. This is similar to physical therapy, in that it aims to retrain the eyes so that they move well together. Advocates say that it can help with eye movement, coordination, and focus. While the evidence is generally scarce, results of a 2008 trial support its use. People should not use eye patches to treat eye conditions such as convergence insufficiency. As well as addressing visual difficulties, people can treat or manage ADHD symptoms through family and parent training, which helps families learn how to respond to and support children with ADHD. In some cases, the outward symptoms of eye conditions in children may lead to a false diagnosis of ADHD. For this reason, it is important to seek an expert evaluation in order to diagnose ADHD, as this can rule out any other potential causes of these symptoms. It is important to remember that while ADHD misdiagnoses can happen, it is possible to have both conditions. Parents, caregivers, and teachers should not attempt to diagnose either themselves. For very young children, routine eye exams can help detect vision problems even before caregivers notice symptoms. Consult a doctor if an adult or child is struggling to see, read, or remain focused. Frequent headaches, eye strain, or difficulty completing work may be signs of an eye condition, particularly if these symptoms only occur when a person needs to focus on something nearby, such as when reading or doing written homework. A doctor can run preliminary tests. If ADHD is a possibility, they can refer someone for an evaluation. A person with untreated attention deficit hyperactivity disorder, ADHD, has difficulty maintaining attention, managing energy levels, and controlling impulses. In the United States, around 8.4% of children and 2.5% of adults have ADHD. In some children, ADHD characteristics begin as early as 3 years of age. Ways of treating ADHD include medication, behavioral management techniques, and other practical strategies. Below, we explore what ADHD is, how it affects a person, and which treatments can help. ADHD may develop in one of 3 ways. A doctor may find that the disorder has a predominantly hyperactive and impulsive presentation, a predominantly inattentive presentation. A combined presentation. People with ADHD experience hyperactivity, impulsivity, and inattention in varying degrees. A range of approaches can help a person manage ADHD. A doctor should work with the individual to develop a treatment plan that suits them best. The plan may include behavioral therapy and counseling. A therapist or counselor can help a person develop or enhance a wide range of skills, such as building and maintaining relationships, establishing and following rules, planning and completing tasks, developing and following a schedule, monitoring ADHD symptoms. Parents, teachers, and other caregivers can help children navigate the challenges of ADHD. Schools often have educational plans for children with ADHD, including specific teaching approaches, classroom